Okay, let's unpack this. When you think about safety records, what industries immediately spring to mind? Maybe aviation, right? With its often cited impressive track record.
Yeah, definitely.
Today, we're diving into a set of sources that reveal a stark and, frankly, quite surprising truth about safety in an industry crucial to all of us:
Health.
healthcare.
Exactly. Our mission for this deep dive is really to understand why U.S. hospitals, despite their absolutely critical role, are described by federal research as, get this, multiple log orders less safe than other high-risk industries.
Multiple log orders. That's, wow.
It is. And what's truly fascinating, or maybe alarming here, is that this research finds 1 in 4 hospitalized patients in the U.S. experiences harm. 1 in 4.
1 in 4.
Yeah, and medical error is cited as a top cause of death. Now, contrast that with U.S. air carriers. Until those very recent small plane crashes in 2025, they hadn't had a crash-related fatality since 2009.
Since 2009, despite millions of flights.
Millions of departures. It really makes you think differently when you step on a plane or into a hospital.
That comparison is just astonishing.
Yep.
So here's where it gets really interesting. The sources highlight that other industries, even when facing similar challenges, like low margins, staffing shortage,
Things we hear about in healthcare all the time.
exactly, they somehow achieved exponential reductions in harm. So the key difference, according to these sources, it's boiled down to accountability rather than excuses.
Accountability, that's the word.
And they don't just point out the problem, they actually propose solutions directly inspired by these successful industries, especially transportation.
Right. And if we connect this to the bigger picture, the sources pinpoint 4 critical areas where healthcare could learn a massive amount. First, there's federal accountability.
Okay.
In transportation, it's pretty clear-cut. The U.S. Secretary of Transportation holds specific responsibility for safety. It's right there.
Makes sense.
But in healthcare, this accountability is described as ambiguous and diffuse. It's not even explicitly in the job description for the Secretary of HHS Health and Human Services or agency heads.
Wait, it's not even in the job description.
Apparently not explicitly for safety in the way it is for transport. It's kind of like having a ship with no single person ultimately designated as responsible for safety systems.
That federal accountability point is huge. So it's not just about who's in charge, but if anyone is truly systemically on the hook. Okay, what's the next critical area?
The second area is timely, transparent reporting of harms. So the transportation industry measures and transparently reports real-time, varied harm information. You hear about incidents quickly.
Right, pretty fast if something happens.
Yeah. Healthcare, on the other hand, often relies on delayed claims data that's info primarily used for billing, and it's typically outdated, sometimes 18 months old.
18 months.
18 months.
Yeah.
And this data can actually reflect, say, coding improvements more than actual clinical quality changes. Now think about this. Key harms like medication errors, surgical complications, which account for over 70% of patient harm, aren't even routinely measured or publicly reported across the board.
So we're often flying blind on the biggest risks, that delay. It seems like trying to navigate by looking way back in the rearview mirror.
That's a good way to put it.
What about collaboration across the sector? Is there a difference there too?
Absolutely. The third point is sector-wide collaboration for safety correction. Transportation uses these highly effective public-private partnerships, like the Commercial Aviation Safety Team, or KST. They use systems engineering to proactively design out risks.
Okay, systems engineering, so looking at the whole process.
Exactly. In healthcare, however, efforts are often fragmented. And the most common intervention, it's often staff re-education.
Just retraining people again.
Yeah, rather than fundamental system redesigns that address the root causes of why the errors happened in the first place.
So less about fixing the person and more about fixing the system itself. That makes sense. Okay, and finally, what about the actual accountability system on the ground?
Right. The fourth point is establishing a robust shared accountability system. In transportation, you have clear accountability for airlines, for manufacturers. In healthcare, it's often delegated to accreditation organizations. Think the Joint Commission or DNV.
Okay, I've heard of them. They accredit hospitals.
They do. But what's concerning, according to the sources, is these organizations are actually paid by the very hospitals they review.
Paid by the hospitals?
Yes. And their focus can sometimes be on, well, more superficial checks. The sources give the example of ensuring ceiling tiles do not have watermarks.
Ceiling tiles? Seriously?
Rather than scientifically grounded harm rates. It's quite a disconnect when you hear that 12 hospitals with central line infection rates 5 times the national average have still been accredited.
5 times the average and still accredited.
Mm-hmm. And many hospitals with low CMS star ratings, that's for Medicare and Medicaid services, like the 6% that had 1 star, 13% with 2 stars in July 2024, they still maintain their accreditation.
Wow.
And accountability often isn't even held at the whole health system level, but rather at individual hospitals, which kind of further diffuses responsibility.
So it sounds like in some cases, hospitals might be getting a pass on really serious patient safety issues while checking boxes on, well, ceiling tiles. That's a stark picture.
It is stark.
But the good news is these sources say these flaws are correctable. What do they suggest is the path forward?
Well, they suggest things like modernizing the conditions of participation for Medicare, requiring these accreditation organizations to actually meet directly with hospital CEOs and boards to review harm rates, the real ones.
Getting it in front of leadership.
Exactly. And even publicly identifying hospitals whose harm rates remain persistently high, creating that transparency.
Okay, so bringing some of that aviation style accountability in.
That seems to be the idea. And this raises an important question, really, for you, the
Mm.
listener. If stronger accountability and truly data-driven systems have revolutionized safety in industries like aviation, what could a similar transformation mean for the safety of patients in our hospitals?
Yeah, think about it. How differently might you view hospital quality if every institution had to publicly report their top harm rates in real time, just like an airline would report an incident? What would that level of transparency truly reveal? And, what profound changes might it actually ignite for patient care? Something to consider.